All right.
It was a young Luke Skywalker that had all the trouble, but little Darth Vader, the little boy we all fell in love with in that Super Bowl Volkswagen ad, we almost had an interview with him this morning, but instead we're talking to his mother. He has a heart condition. A lot of people may not know that. The little boy's name is Max Page. He has a heart condition, and he was busy when we wanted to talk to him. He was on a movie set. So filling in for him is his mother, Jennifer Page, and a doctor from Children's Hospital Los Angeles on diagnosing heart conditions right from the start. Who could forget the little Darth Vader commercial from the Super Bowl from a few years back, a couple of years ago now? Little Max Page captured America's attention as that adorable little Vader. And with us today to talk about what Max was going through and something a lot of parents are dealing with as well is Jennifer Page, Max's mom, and Dr. David Ferry, a cardiologist from Children's Hospital of Los Angeles, here to talk all about congenital heart defects, the most common birth defect. I didn't realize that.
Yes, it's about 40,000 babies a year in the United States are born with a congenital heart problem. That's 100 a day.
Wow.
And about half of those babies born will need some type of intervention or surgery throughout their life, and sometimes several procedures. So it's a common issue for a large population, and it's a very common problem that we deal with at Children's Hospital.
Jennifer, when did you find out that Max had a problem with his heart?
You know, I was at a routine appointment at 38 weeks into my pregnancy. Everything had gone smoothly up to that point, and they didn't get a good heartbeat on him during a routine check. So he was taken emergency C-section, and then over the course of the next couple days, they diagnosed him with tetralogy of Fallot, pretty severe congenital heart defect.
Did you ever wonder how, how Max would fare as an older child, and then look at him today and think, wow,
Oh, no question. I mean, those first months, even first couple of years, I mean, I remember just begging for a chance to know him because truthfully, taking him in for her open heart surgery at 3 months old, wow. I mean, you hand him off and you're just begging to get them back, and really had no clue what life looks like. Had no role models, had nobody living out, heart disease out loud to see what it looked like. And that's why we're so passionate about bringing this awareness to families. So Mended Little Hearts, in conjunction with St. Jude Medical Device Company, to come and say, here's a guide and here's a community of people. So when you do get this diagnosis and you feel isolated, and typically you're in an isolation room when it happens for recovery, you're not alone. There's a whole community out there, and there's some great resource to know questions to ask, and to everyday life questions that even can get answered there. So we're just very passionate. We feel like the acting thing has just given Max a platform to show people you can live a full active life. And he's had 9 surgeries, so we're very much in part of this community, and still he can live a full active life.
Wow, that's an incredible message for parents, like you said, who may just be getting the news like you did while mom was still pregnant. Dr. Ferry, Mended Little Hearts, I mean, you can do surgeries on children how soon after they're born?
Well, if necessary, they can be operated upon right the first day or two at a weight of maybe 4 pounds. Max was able to wait until 3 months of age, but that's the thing. Early on, as Jennifer mentioned, the baby is whisked away from the parents, and among other things, it's a very lonely and scary experience. So they can go to a website that St. Jude's has up. It's sjm.com/weheartkids. That's WEHEART kids, and it has resources there for families who are going through this process, which is a very scary and lonely experience.
Okay, Jennifer, how's Max doing today?
Well, he's doing great. He's actually filming his first movie right now, so he's out on location for 4 weeks. Totally excited. He's doing great. Plays baseball. He's a huge sports fan. Plays golf. Beats up on his little brother, all the normal kid things. So totally fun, smart, loves school. So we're totally blessed.
What a wonderful update to that little Darth Vader that we all met and fell in love with during that commercial. Did you think that commercial was going to capture America's attention that much, or were you overwhelmed by the attention?
Oh my gosh, so overwhelmed. I remember at one point, because they put it out on YouTube ahead of time, and it was like at 6,000 views, which I thought was like astronomical, and now it's like at 60 million views or something silly. So no, we certainly had no idea that that would be the trajectory that it was, but it's been nothing but, it's brought nothing but goodness, especially for the heart community.
That's wonderful, and you're right. It allowed you, it gave you an ability to speak your truth about congenital heart defects, and then of course Max is a great role model for all of those who are dealing with it, and maybe just getting the news right now that look what's possible with intervention.
So much hope. There's so much hope, and that's the biggest thing. And, you hear heart and you just get petrified, but tons of hope and tons of people waiting to do life with you, for sure.
sjm.com/WeHeartKids. Dr. Ferry and Jennifer, thank you very much for joining us. We appreciate it. It's great to get an update on our friend Max.
Thanks.
Our pleasure.
And Max is a big kid now, isn't he?
Yeah, he is. He's no longer that little boy.
I know, he's such a big kid now, but he's still acting in movies, and that's why we couldn't talk to him that day, because he was busy on a movie set somewhere.
Good for him. When we come back, Mark will have a full look at the forecast.